Welcome to Sato Career 2.0 online nursing channel. AIIMS Nursing Officer Exam Rishikesh 2019. In this video, we are going to discuss 30 most important questions for this exam. Before going to see these questions, please subscribe to Sato Career 2.0 online nursing channel. To get more updates, please click on the bell icon to get latest notifications. Let's see the first question of the day. Fever can cause which of the following problem? Option A, fluid loss. B, hyponatremia. C, hypokalemia. D, fluid overload. The right answer is fluid loss. Let's see the rationale. The body's response to fever is to bring fluid to the surface area, which have increased temperature, creating a diaphoretic state and thus a loss of body fluids. Question number 2. Following prolonged and extensive surgery, it is most important for the nurse to observe the client for the depletion of which of the following electrolytes? Option A, sodium, B, calcium, C, chloride, and D, potassium. The right answer, option D, potassium. The rationale behind this is release of adenocorticosteroids, cortisol by the stress of surgery causes renal retention of sodium and excretion of potassium. Although sodium may be depleted by nasogastric suction, retention by the kidney generally balance this loss. This is not depleted by surgery or urinary excretion. Question number 3. Following surgery for repair of an inguinal hernia, the nurse establishes a postoperative fluid intake goal for the client. The most appropriate amount would be option A, 500 to 700 ml per day, B, 1000 to 1500 ml per day, C, 2000 to 3000 ml per day, and option D, 3000 to 3500 ml per day. Let's see the correct answer. Option C, 2000 to 3000 ml per day. Let's see the rationale behind this. Maintenance level post-surgery is between 2000 to 3000 ml per day. The client's body will require additional fluids over the minimum due to fluid loss and the recovery process after surgery. Minimum fluid intake is considered 1500 ml per day. Question number 4. In a client aged 60 years, a serum creatinine level that would indicate the client has a mild degree of renal insufficiency is option A, 4.0 milligram per deciliter, option B, 3.3 milligram per deciliter, option C, 1.7 milligram per deciliter, and D is 0.8 milligram per deciliter. The right answer is option C, 1.7 milligram per deciliter. The rationale: the serum normal creatinine level for a male is 0.6 to 0.9 milligram per deciliter. A client with a mild degree of renal insufficiency would have a slightly elevated level, which in this case would be 1.7. Levels of 3.3 and 4.0 may be associated with acute or chronic renal failure. Question number 5. In which of the following conditions the client will have flush dry skin? Option A, edema, B, shock, C, dehydration, and D is hypervolemia. The correct answer is option C, dehydration. The rationale: with dehydration, the skin becomes flush with increased blood flow to the surface capillaries. The skin thereby becomes dry and warm. Question number 6. Caxolate is ordered for a client whose serum potassium is 5.5 milliequivalent per liter. If this substance is effective, the nurse should expect to see an ECG with option A, return of T wave with an amplitude to normalcy. Option B, broad flat P waves. Option C, absence of P waves. Option D, return of QRS to the upright configuration. Now, the nurse should expect to see an ECG with when the serum potassium level is 5.5 milliequivalent per liter. The right answer is option A. Return of T wave with and amplitude to the normalcy. The rationale, the caxylate should bring the potassium level down. When this occurs, the effects on the T wave reverses and the ECG will return to normal. Question number 7. Maintaining fluid balance in the body is performed mainly by the option A liver, B heart, C lungs, and D is kidneys. The correct answer is kidneys. The rationale, the kidneys regulates fluid balance by adjusting the amount of fluid reabsorbed from the glomerular filtrate. The liver does not play a major role in fluid balance. The heart is primarily a pump for the movement of blood. The role of lungs is minimal. Question number 8. Post-operative orders are 1 liter of dextrose 1% normal saline with 40 milliequivalent per liter of potassium chloride. The liter of ringer lactate has not completely infused. What will the nurse do? Option A, finish the current liter of oral fluid. Option B, ask the client if he needs to void. Option C, hang the ordered IV. And D is assess the IV site. The right answer is option A, finish the current liters of oral fluid. The rationale, the cost effective and safest decision is to finish the current liter of fluid. The second and fourth answers not relevant to the ordered fluid. The third answer does not recognize whether the client has voided and is least cost effective. The liter of Ringer's lactate has already been considered in the daily intake. Question number 9. We have the answer first. So I skip on the question number 9 and I go to 10th question. The client returned from the recovery room to the surgical unit. Following laminectomy surgery, the nurse would anticipate that the most common complication following anesthesia would be option A, atelectasis, B, pneumonia, C, paralytic ileus, D, edema. The correct answer is atelectasis. The rationale is even before pneumonia, atelectasis may occur as a result of alveoli not being expanded. This leads to an alterations in gas exchange. Paralytic ileus could result from any surgery, especially if the client ingests food before the bowel is functioning properly. Question number 11. The coronary care unit nurse draws an arterial blood sample to assess a client for acidosis. A normal pH of arterial blood is option A 7.0, option B 7.30, option C 7.42 and D 7.50. What is the normal pH of arterial blood? The right answer is 7.42. The rationale, arterial blood has a narrow pH range of 7.35 to 7.45. Venous blood is more acidic and closer to 7.35. than a arterial blood, which is normally closer to a pH of 7.45. A pH of 7.0 is very acidic and needs immediate treatment. A pH of 7.30 is slightly acidic for both arterial and venous blood. A pH of 7.50 is alkaline and needs treatment. Question number 12. The electrolyte balance in the body is regulated by which organ system? A. Kidney, B. Heart, C. Parathyroid, and D is liver. The correct answer is kidneys regulate the electrolyte balance in the body. The rationale, the renal system controls the excretion of sodium and potassium through the counter current mechanism. Question number 13. The most important electrolyte present in the intracellular fluid is option A sodium, B calcium, C chloride, D potassium, which is the major electrolyte present in intracellular fluid. The correct answer is potassium. Question number 14. The 13 rationale is the concentration of potassium is greater inside the cell and is extremely important in establishing a membrane potential. A critical factor is the cell's ability to function. Sodium is the most abundant cation of the extracellular compartment. Calcium is the most abundant electrolyte in the body. Question number 14. The nurse advises a client not to take bicarbonate of soda regularly. This statement is based on knowledge that bicarbonate of soda can cause option A gastric distension, B metabolic alkalosis, C chronic constipation, D cardiac dysarrhythmias. The right answer is metabolic alkalosis. The rationale, prolonged use of sodium bicarbonate may cause systemic alkalosis as well as retention of sodium and water. Gastric distension, chronic constipation, and cardiac dysarrhythmias are inaccurate in describing the effect of sodium bicarbonate. Question number 15. The nurse understands that chemotherapeutic medications and antibiotics along with which other medications increases the risk of infection. Option A beta blockers, B steroids, C aspirin, D calcium channel blockers. The correct answer is option B steroids. Question number 15. The rationale is long-term steroid use depresses the immune system, making the client susceptible to infection. 16. The post-operative client in the recovery room suddenly becomes cyanotic. The first nursing action is option A begin oxygen per nasal cannula. Option B call for assistance. C suction the nasopharynx. D insert on oral airway. The correct answer is suction the nasopharynx. The rationale is the first priority is to clear the airway and free it from any mechanical obstruction. Question number 17. The premenstrual hemoglobin of a 24-year-old client with no history of trauma, recent surgery, or hemorrhage is 9.8 gram per deciliter. The nurse interprets that this value is due to option A iron deficiency anemia, B hypovolemia, C dehydration, and D is cardiogenic shock. The correct answer is iron deficiency anemia. The rationale, the normal HB for a female is about 12 to 16 gram per deciliter. With the data given, the nurse would suspect for anemia. Question number 18. The priority assessment finding in client who has sustained burns on the face and neck is option A spreading larger clear vesicles, option B increased respirations, option C difficulty with vision, and D is increased thirst. The correct answer is option B increased respirations. The rationale is the primary assessment for a client with burns on the face and neck is with the respiratory status. As edema form, possible inhalation surgery may lead to bronchospasm and ineffective airway clearance. Question number 19. The receptors for the regulation of body water through osmotic pressures are located in the option A blood, B hypothalamus, C kidney tubules, and D is neurohypophysis. The right answer is hypothalamus. The rationale, the osmoreceptors are located in the hypothalamus. Under the condition of dehydration, they stimulate the neurohypophysis and release antidiuretic hormone into the blood. Question number 20. The rectal temperature of a 4-month-old client is 103.6 degree Fahrenheit. The most appropriate nursing action that decrease the temperature is to option A. Place the client in a cool, moist cropette with compressed air. Option B. Sponge the trunk and extremities of a client with tepid water. Option C. Encourage the client to take clear liquids such as apple juice. And D is sponge the client with a solution containing half water and half alcohol. The answer is option B. Sponge the trunk and extremities of a client with tepid water. The rationale, tepid sponge bath reduces temperature by promoting evaporation. Ice or alcohol baths may reduce temperature too rapidly, leading to vascular collapse or vasoconstrictions. Question number 21. TSH ultrasensitive assay has been ordered for a client and she asked the nurse the purpose of this test. The most appropriate reply is option A. The test is a screening test to diagnose thyroid disorders. Option B. The doctor is testing whether you have Hashimoto's disease. Option C. The test measures absorption of iodine and how it relates to the thyroid gland. Option D. The test indicates whether your thyroid gland is over or underactive. The right answer, option D. The test indicates whether your thyroid gland is over or underactive. The rationale is the clearest and best reply is a general description of the test, but not specific enough to frighten the client as in option A and B. 22. When intravenous fluid is allowed to flow into a person by gravity, option A, the potential energy is converted to kinetic energy. B, the kinetic energy is converted to potential energy. C, the chemical energy is converted to kinetic energy. And D, the potential energy is converted to chemical energy. The right answer is the potential energy is converted to kinetic energy. How? The fluid is the fluid in a bottle hung over a person who is lying down possesses a potential energy. When the fluid is allowed to drip into the intravenously, its potential energy is then converted into kinetic energy. Question number 23. When the client's serum potassium level is 5.8 milliequivalent per liter, the nurse should first option A. Call the laboratory and repeat the test. Option B. Call the resuscitation team and alert them to obtain an ECG strip. Option D. Take the client's vital signs and notify the physician. The correct answer is option D. Take the client's vital sign and notify the physician. The rationale behind is vital signs monitor cardiopulmonary status. Hyperkalemia causes serious cardiac dysarrhythmias. Question number 24. Which group of cells in the circulating blood is the first line of defense against bacterial infections, working primarily through phagocytosis? Option A, monocytes, B, platelets, C, neutrophils, and D is basophils. The right answer is option C, neutrophils. The rationale is neutrophils are the first line of defense against infection. They live in the circulation for about 6 hours after bacteria is ingested. 25. While assessing for immediate postoperative complications, which of the following complications is likely to occur following unresolved atelectasis? A. Hemorrhage, B. Infection, C. Pneumonia, D. Pulmonary embolism. The correct answer is pneumonia. The rationale is pneumonia is a major complication of unresolved atelectasis and must be treated along with vigorous treatment for atelectasis. While evaluating the effectiveness of preoperative teaching to a client before colostomy surgery, the nurse expects that client will be able to: option A, describe how the procedure will be done. Sorry. Sorry. Option A, describe how the procedure will be done. Option B, exhibit the acceptance of surgery. C, explain the functions of colostomy. And D, apply the colostomy bag correctly. The right answer is explain the functions of the colostomy. The rationale: successful teaching can be validated when the client is able to repeat the information. 27. Prophylaxis for hepatitis B includes option A, preventing constipation, B, screening of blood donors, C, avoiding shellfish in the diet, option D, limiting the use of hepatotoxic therapy. The right answer is screening of blood donors. The rationale: contracting hepatitis B through blood transfusion can be prevented by screening donors, and testing the blood does not prevent the transmission of hepatitis B. 28. Thrombophlebitis is a common complication following vascular surgery. The sign that indicates a possible thrombus formation is option A, Kernig sign, B, Heger sign, C, Homan sign, and D is Brodsky sign. The right answer is Homan sign. The rationale: Homan sign is on dorsiflexion of the foot. The client will experience upper posterior pain in the cough if a clot is present. Option B, Kernig sign, which indicates presence of meningeal irritations, and Heger sign is a softening of the uterus. Brodsky sign is when flexion of the head causes flexion of the knee and thighs. It is also the sign of meningeal irritation. Question number 29. The nurse should prioritize care and provide treatment. The client who should get priority is the one with option A, head injury, B, fractured femur, C, ventricular fibrillation, and D is a penetrating abdominal wound. The right answer is option C, ventricular fibrillation. The rationale: ventricular fibrillation will cause irreversible brain damage and then death within minutes because the heart is not pumping blood. Question number 30. A client's condition following cardiac catheterization is evaluated by palpating the pulse. Option A, in all extremities, B, at the insertion site, C. Distal to the catheter insertion, and D is above the catheter insertion. The correct answer is option C. Distal to the catheter insertion. The rationale: palpating the pulse distal to the insertion site is important to evaluate for thrombophlebitis and vessel occlusion. The pulse should be bilateral and strong. So here we come to the end of today's questions. Thanks for watching. Please subscribe to Sato Career 2.0 online nursing channel to get good videos. Thank you. Bye bye.